Hey listeners, it's Paul Andriola here. Why not join our community at Small Cap Discoveries, where we offer our members direct access to some of the best microcap investment opportunities available. Our members are getting access to premium microcap financings, research reports, and direct access to management. Sign up today at www.smallcapdiscoveries.com.
Hi, everyone. Welcome to the Small Cap Discoveries conference call. Today is August 16th, 2024, and today on our call we have the CEO, Craig Mull from Cipher Pharmaceuticals. Cipher trades on the TSX exchange under the symbol CPH, and it also trades on the OTC under CPHRF. The company is currently trading at $14.05 with about 26 million shares outstanding, or about a $360 million market cap. I'd now like to hand it over to Paul Andriola.
Hey, thanks a lot, Trev. Yeah, great to have Craig here today, especially since there's been some pretty significant new sort of milestones and new things that have happened to the business since we last spoke. So Craig, thanks for joining us. Excited to hear about your newest acquisition. So I'm just going to turn it over to you. But before we sort of get into those updates, just remind everybody what Cipher is all about.
Sure. Thanks for having me today. With me today is Brian Jacobs, Cipher's president of U.S. operations, and Ryan Mailing, who's our new CFO. So again, thanks for having me. As an update, and I don't know where the individual listeners are in the story, but Cipher is a specialty pharma company. We operate in North America. We have a derm focus, and included in that derm focus is a leading acne drug that in Canada is called Epuris, and in the US it's called Absorica. That's our lead product. We have been able to generate a significant amount of ongoing cash flow from our derm portfolio that includes products beyond the acne product in Canada. Our portfolio in Canada is growing, mainly led by Epuris, which is the acne product. In the US, we have a number of products that we took through FDA approval back in early 2000s. Those products are still selling today. Those arrangements are usually royalty type of arrangements with commercial partners. So the business has been doing very well over the last 4 years. We've improved the margins in the business. We produce an excellent EBITDA. We've paid off all of our debt. And prior to the acquisition that Paul referred to, we had roughly $45 million US on our balance sheet. That's changed now from the acquisition. But you know, the acquisition, again, is a US-based company focused in the anti-parasitic market. It has had a long history of continued sales and growth and in EBITDA. And with that, I'm going to turn it over to Brian, who will better describe that acquisition.
Yes, so thank you, Craig. Craig and I, as well as Ryan, we were spending a lot of time trying to find our next acquisition, but we were willing to take time to do it. And we looked at a lot, over probably 100 opportunities, Canada and the US. And we landed on the Natroba business that we acquired from Parapro. The reasons why Craig and the board and myself really liked it is that, you know, it was a kind of a family run operation, you know, which is always a tight ship. And the business ended up being kind of a perfect marriage with Cipher. Just run very well, strong sales growth and earnings. And unfortunately, in the specialty pharma space, a lot of businesses aren't run that way. They're run with the promise of growth and expensive infrastructure, and that inflection will happen, whereas this business just grew steadily over time, and we believe has a lot of room to grow as well. So the product itself is a product that's indicated for head lice and scabies called Natroba. It's authorized generic spinosad. It's not a genericized market. We own the authorized generic, which was really just a go-to-market strategy in order to get into state-level payer systems. Where we see that opportunity with the U.S. market is that currently Natroba has less than 25% of the market share, and the market is owned by a genericized permethrin market. So permethrin, it would have been, when I was a kid, I would have got treated with permethrin for head lice. I did have it one time, but parasites have developed resistance to it over time. And you can just look it up on the internet that a lot of parents have to get frustrated and dose their kids over and over with the same product, and it doesn't get rid of the head lice. So really where we see there's a lot of room to grow is that really just educating physicians and growing state level reimbursement for the product because it's the only one on the market that really works. So permethrin's got the 70 indicated in the anti-parasitic market has about 75% market share. So we believe that there's an easy room to grow the product in just the US alone. Maybe I'll pass it over to Craig to talk about some of our other growth plans.
Yeah, thanks, Brian. So again, we've got a product that, as Brian said, has about 22% of the anti-parasitic market. The main product is permethrin, and it's widely known now that lice and scabies have developed a resistance to that product. So the first and the easiest step for us to take is to go and gain market share in the U.S. And that's all in place now. And we've got an infrastructure down there that has been growing the business, and we're going to help them grow it faster. The other areas of growth, again, that come along with this acquisition is our ability to what I call cross-pollinate products between our Canadian portfolio and our U.S. portfolio. We've got, as I mentioned earlier, we've got 3 products that are sold in the U.S. through commercial partners. We'll be evaluating whether we need those commercial partners going forward or whether we can do it ourselves and obviously collect a much bigger earnings price tag to that. The third area of growth is to find complementary products to the Natroba products, where the call point's the same. With lice and scabies, it's generally pediatricians, dermatologists get involved, and perhaps family doctors. Head lice and scabies is an acute indication, meaning that you need to deal with the issue immediately. You can't wait. And we're looking for other products that have that similar profile. And we believe that we found a few, and we're working on those. But the sales force is currently underutilized in the U.S., and we believe that they have the capacity to add a number of products to their bag, and that's a real focus for us and a real growth potential, particularly for the U.S. market. The fourth leg of growth, or the fourth item of growth, is that through this acquisition, we own the product for scabies and lice. It's called Natroba for anywhere in the world. And so we know that scabies and lice is not a North American indication. It's a worldwide issue. And so we have received, and we're in discussions with different commercial partners in Europe and Asia about out-licensing the product in those areas. And that out-licensing would usually take the form of some form of royalty payment and milestone setup. So, that's an area that we think that, we could move on quite quickly, and all that royalty and milestones would fall directly to the bottom line. So, we think that we've got great options for growth in the U.S., and we're pursuing them at the moment. In Canada, as I indicated earlier, we've got a solid business that is growing, mainly led by Epuris at the moment. And your listeners may recall that, in our development pipeline, we have a product called, we refer to as MOB-015. It's a nail fungus indication. And, we've talked about it, and we've mentioned that we're waiting for the readout on the current phase 3 trial that's being run in the US. We expect to get that readout in January of this coming year. I think that because of some changes made in the dosing regimen of the product, that we'll end up with a complete cure rate that would be higher than the main product on the market, and that product's called Jublia. Jublia has about 90% of the nail fungus market in Canada, and that market is roughly $90 million. So, it's a significant opportunity for us. And it will further drive our Canadian growth. So, we've got a number of different things we're working on, and they all look doable and achievable from our standpoint. And, Cipher could look like a much different company in two to 3 years than it does now. Trevor?
Perfect. Yeah, no, perfect. Thank you, Craig and guys. Why don't we jump on the Moberg product you just mentioned, or it's already being sold in Sweden. Maybe some highlights or some data that you can tell the listeners about sort of success so far in that market.
Thanks, Paul. Go ahead, Ryan.
Yeah, the one area we would say we have early indication on is, and it came out a lot from Moberg's publications, is the product has rapid onset, and that's high mycological cure is really part of the success of that product. Because if you have nail fungus and you start using something, and it's a year-long treatment, you start using it in the beginning, you want to see some results. Otherwise, you don't know why you're continuously using it. So that's really why people are, it's an unmet need. A lot of products don't cure the fungus. So you get something and it starts to work quickly. And that's why we think it's had very rapid uptake in Sweden, and, really bolsters the position for the product. The other area is that the phase 3 trial that's happening in North America is to use that same formulation but reduce the dosing. And that'll also help with compliance. So if you think about it, you use the product for the first 2-3 months, it'll quickly cure some of the problem, and then you can get to reduce it to once a week. So we think that, that's kind of almost like a 1-2 punch where, we see being able to launch that product in Canada and rapidly take the market share is important.
Just to add to that, Brian, Moberg launched the product in Sweden, as Paul indicated, and within 3 months, it was the market leader. And more importantly, they believe that they grew the market by 52%. And so, that really tells me, there's an unmet need there, because people aren't even using the products that exist. And if a product that comes to market works, there'll be a lot more patients needing it or wanting it. And if you Google or whatever you do for Terclara, which one of your listeners asked a question about, people are trying to get it in the US. They're trying to import the product. It's just gone over very, very well, and we expect the same type of success in Canada.
Craig, you sort of touched on one of the questions I was going to ask. Just in Canada alone, like the current drugs that you have, maybe give us an idea of what the potential market is for all the different products you're selling to Canada.
In Canada, again, I'll start with the lead product, Epuris. We have about 60% of that market, and our sales of that product are in the range, and Brian, correct me, or Ryan, correct me if we need to, probably in the range of $18 million a year, 18 to 20. And we have 60% of the market, so that shows you the size of that market. The nail fungus product, again, a $90 million market. We would expect that market to grow if there was a product that worked. In the US, our Natroba product for scabies and head lice. That market is roughly 150 million. Again, the same concept would work there. A lot of people have been forced to try OTC products that are equally ineffective to permethrin. So with a product that works and a product that people know and are aware of, could expand that market quite significantly as well. The markets in Europe and Asia for the product, a little hard to calculate at the moment. We're attempting to do that now, but I think population's a pretty good proxy for market size.
And the latter half of the question, in terms of Teclara, is just the profitability of Teclara in Canada. What kind of margins do you expect to get on that?
The margins will be a little bit lower than call it our existing portfolio. Just kind of with the cost of bringing the product in. But we still see a pretty strong margin profile there. Too early for us to disclose, or wouldn't want to disclose the exact margin on that product for competitive reasons.
One of your listeners had asked there, about the royalty from Teclara. We're not envisioning collecting a royalty. We're actually going to be selling the product in Canada. We've got a sales infrastructure, and that product would go through there. So royalty isn't an issue other than one that we pay back to Moberg.
Right. Yeah. Right. Yeah. Understood. And then you mentioned, and sorry, is it Metroba, or I know Natroba is the name of the sort of the company you bought. What's the market size in Canada? I'd imagine it's just 1/10 the size of the US. Does that make sense?
Yeah, I would use that. Like the Canadian market is something that we will do because we have everything here already.
Sure.
But, if we didn't have, it wouldn't be the first stop.
Of course. Yeah.
So, we don't have huge expectations, but a 1-to-10 ratio, I'd say that the market in Canada would be 15 to 20 million bucks for antiparasitics.
Yeah. Okay. Fair enough. Okay. So the other questions I've got coming in here, well, I know the answer, but I'll ask it anyway. If phase 3 trials fail in the US, will Cipher launch Teclara in Canada? How does that work if there's a sort of a negative result in the US?
Well, it will, part of getting those results are part of our deal with Moberg. And it's a question that we debate all the time, what to do, because the mycological cure rate, which was in the initial phase 3 trial, we believe in the same results will be obtained in the second phase 3. The mycological cure rate is exceptionally high. Mycological cure rate speaks to how well does the product deal with the fungus. So, the product deals with the fungus very well. The issue at that time was the complete cure rate, which includes a second component called cosmetic cure rate. What does the nail look like? So, it didn't do as well with that because we believe that there was too much drug being added to the nail. And that's one of the reasons why the dosing, as Brian indicated, has been reduced to once a week after the first 8 weeks. So, what to do if it comes back with a complete cure rate less than Jubilee? We're considering our options.
Okay. Other questions come in here. Dave says, from what I understand, Moberg will be developing their own sales force in the US, focus on the podiatrists, and will look to license the US rights to MOB 15 to accompany marketing to dermatologists. With your new US sales force, how aggressively are you going to pursue the US rights?
Aggressively.
Good. Perfect. Short and sweet. Okay, and Dakota asks, sorry if it's been mentioned and if too early, but any thoughts about in-licensing Absorica for US? I guess that's the first part of the question, and I'll let you answer that if there.
Dakota, your you're right on that. And I referred to it, as cross-pollination. We have to look at whether it would be more lucrative for us to take in the product directly and sell Absorica directly in the US.
Mhm.
And that is certainly high on our consideration list.
Mhm. Yeah, you had mentioned that earlier, so appreciate that. Um, Hand off to Clara to Okay, hand off to Clara to Mull. This is hourly to Clara data from 682 pharmacies in plain text, mostly accurate. Not quite sure what it means by that. I'll uh, I'll leave that one alone. Dave says, how many new salespeople are you looking to add in the US?
Well, we currently have 35 field sales reps in the US now and 16 inside reps. Adding these complementary products, and I'm going to refer back to Brian after this, but
Mm.
the complementary products are going to need more people, and Brian may decide that we need more people to cover uncovered areas in the U.S., which there's quite a few of already.
Mhm. Mhm. Gotcha.
We
Gotcha.
are going to continue to manage it the way that Parapro managed the Natroba business previously. I don't think we just say, well, look, we're going to hire an army. Arguably, the metrics wouldn't make sense until you get another product.
Mhm.
But we just think about it tactically. So, for example, if you have favorable reimbursement within a certain state, and you negotiate that contract, you put a direct rep there.
Mhm.
Or maybe you're using covering it by inside, and then you shift it to become an outside rep. So we're going to be doing little tactical moves like that, but that's 50 people in total. So it's
Mhm.
just kind of tweaking that existing as opposed to thinking about adding layers onto it, because that would be getting away from our business philosophy. We don't
Mhm.
add unnecessary costs. We do tactical moves.
Mhm. That makes sense. I mean, this is a decent chunk, nice size acquisition here. What does it do to your plans for further M&A? Do you slow down? Are you still aggressively looking at other opportunities?
I would say that we're aggressively looking at other opportunities. And,
Mhm.
and we have been looking at these opportunities, even before the acquisition, where we were looking for the right fit of additional products if the acquisition happened. So
Mhm.
we're down the road quite a bit on a few complementary products.
Mhm.
It's not going to slow us down. Now that we've got that base, we need to grow. We need to grow so that base covers a lot more revenue than it is now.
Mhm. And I imagine it's still within sort of the dermatology market. How best do you describe sort of your M&A pipeline in terms of where it is and how it looks?
A lot of it, I can't speak to directly, obviously, but
Of course, yeah.
we've got a couple of products that would fit very well within a Natroba product. They're acute in nature.
Mhm.
They're pediatrician derm-based indications. Um, that's speaking to the U.S. In Canada, again, that Moberg product has got us really excited.
Mhm. Mhm. That's awesome. Clearly, the stock has done exceedingly well over the last little while. I would almost think that, the first time we started talking, it seemed like there wasn't a lot of people paying attention, certainly more people paying attention right now. How does that, the higher share price and the more attention you're getting right now from the capital markets, does that change how you operate the business right now?
No,
Okay.
no, I mean it's given us another option on raising capital if we need to.
Mhm.
Although I think of every CEO that around would say we think our stock price is cheap today.
Mhm.
Uh, Brian negotiated what I consider to be a very attractive debt financing with the National Bank that's given us, the ability to use more debt. And Brian, I'll pass it to you on this.
Yeah, so I mean, and it tags with your earlier question, Paul, is, do you plan on still going? we wouldn't have negotiated the facility that we did, which still has under the revolver, we can draw another 25 US and 25 million, as well as an accordion for 25 beyond that. So we want to maybe be able to have the dry powder and have it available, because we don't plan on sticking right here. We will see a lot of great things about the Natroba business. The one thing that Craig mentioned earlier is there's inefficiencies within the sales force, because we don't think that one product sales force makes sense. Add a product in the same call point. It only makes good business sense, and you utilize that infrastructure. So that's what we'll be adding. We're not going to add allergy or heart medication.
Yeah, makes sense, of course. What sort of keeps you up at night? What challenges, if any, are you guys facing right now, do you think?
Well, it was one of the big challenges that we had was finding the right leg of growth. And I got to say that we're happy with what we see there. And so, that non-sleeping issue is gone for us. Now it's, where do we grow from here? The US payer market is always a concern. It's constantly changing. So that keeps us up a bit. The idea of generics coming out, there's some mild concern there, but we don't see it. As I said to others, Brian or Ryan got hurt, that would keep me up at night. But that's not going to happen. So, things look pretty good right now, and we want to further execute. We've got our base to really grow upon. So, it's pretty exciting times in my view.
And NASDAQ, your share price now is significantly higher. You're a much more robust business. I think you've even mentioned NASDAQ possibly in the past. Any discussions around a NASDAQ listing? Obviously, a significantly larger pool of life science investors there.
I see this acquisition as Cipher's first step in really migrating the business to a US-based business, and part of that would be a NASDAQ listing, and that's something that we have in our near-term plans.
Good. Okay, another question from Dakota with big words. I'm going to do my best here to pronounce them properly. Piclidenoson from CanFight made a big noise about Lowe syndrome a year ago, and then at least the beginning of human trials started in Japan. If something happens here that's positive, can you use your Canadian license? It's a rare disease with no treatments.
Just give me the last part of that, Paul.
It says, if something happens here that's positive, can you use your Canadian license? Question mark. It's a rare disease with no treatments.
Well, I mean, obviously we're hoping for those positive results. It's for plaque psoriasis, and the specific area that they're focusing on, the Canadian market is about $45 million. There are some competing biologics. We'd like to see the data. So far the profile looks really good. The market looks like it's got an unmet need. We need the results from that Japanese trial, and we think that it could be an excellent complement to the derm portfolio that we have again.
Okay, good. And then Dave asks, do you have any current sales data from Sun? What sort of top line estimates is Absorica doing in the US?
Ryan?
Yeah, we unfortunately, just for competitive reasons, we usually just don't disclose the exact sales. We do have some information from Sun on that, but it's confidential. So we can't think about that. But I mean, if you think about where Absorica does right now from a royalty basis, and estimating the royalty and kind of reinventing the math. I know he's trying to, or it's a question to solve for a potential outlook on the business. So I think that's the way I'd look at it is take a look at our royalty income and the rate and reverse engineer.
Okay, fair enough. Fair enough.
Put it this way, Dakota, I'm sure that we're earning less than Sun does on that project.
Yeah. Okay, good. Okay, it looks like that's all the questions from our listeners. As we continue to monitor the company and watch how you guys are doing, where do you think, where should we focus the most? What kind of metrics or catalysts do you think we should be really watching closely?
Well, I think that, our market share gains with the Natroba product line is important. I think in Canada, continue to watch the sales increases of Epuris, and obviously that readout in January for the MOB product will be important.
Perfect. Okay, good. And then just your sort of last message, last key takeaway you want to make sure everybody walks away with in the event that we missed anything. What do you think everybody should really walk away knowing about the business right now?
Well, I think that, Cipher's base business before this acquisition was a very strong, cash flowing, stable business that generates a significant amount of ongoing cash. And the acquisition in the US of the Natroba line and infrastructure really has now provided us with a number of excellent growth options, which we didn't have before. Cipher is going to end up looking like a much different company in the not too distant future. We're going to be significantly higher in revenue. Our earnings will continue to clip along in a steady fashion like we've done for the last 4 or 5 years. And we think the stock is incredibly cheap for where we're going to go.
I remember you saying that the first time we talked back when the stock's around $3 or $4. So far, so good. So we're real happy to see that.
You're going to jinx me, Paul.
Well, look, just keep doing what you're doing. I think you've got little things to worry about. No, I appreciate it. Craig and team, Brian, Ryan, appreciate the time you guys have spent with us. Love what you guys are doing and can't wait to get a follow-up after your next major event.
Thanks for having us. Appreciate it.
You got it. Appreciate it.
Thanks for having us.
You got it. Bye for now.